Hi everybody, welcome. My name is Ruth Ochoa, and today we're going to go over a nice easy bedtime routine for those of us suffering with low back pain or just a sense of tension in the low back. So maybe you had a really big workout that day, or you were really active, played a lot of golf, or did a lot of lifting, and you're noticing your low back is just feeling kind of tired and stiff. This is a great thing to do right before bed. So you can do all of this in bed. If you're listening along right now, I will be following the timelines for everything so you can just listen while you're in bed. So let's get started. All right, so go ahead and lay down on your back if you aren't already. If you are in bed and you have a pillow under your head, that's okay. Just make sure you don't have anything too bulky under your neck, okay? So go ahead and bend both of your knees. And we're going to let both knees fall outward and allow the bottoms of the feet to touch each other. So most of us call this a butterfly stretch. And it's such a nice way to end the day, allow the inner thigh muscles to really let go and relax. So let me go ahead and start our timer. We're going to be here for 5 minutes. Good, and if you have space wherever you are, go ahead and open your palms. So rotate your hands so that your palms are facing up. And they should probably be supported by the bed you're laying on, or if you're on the ground, that's okay too. But just feel a nice little stretch through the shoulders, the front of the shoulders and the pectoral area, as well as the lower body. So start taking some slow, deep breaths. Close your eyes. Let yourself relax. You made it through the day. Good job. And breathe. Think about slowing your breathing down. As you inhale, allow your lower abdomen to fill with air. As you exhale, the lower abdomen flattens. Go ahead again and inhale, sending the breath all the way down to the bottom of the belly. Really letting the lower abdomen expand on that inhale and allowing it to fall on the exhale. And just continue to breathe like that at whatever pace feels nice and natural for you. Notice what's going on in your lower body. So you might be feeling a lot of stretch right now, or you might not be feeling that much stretch, depending on how your day went. That's okay, it's still helping. So just do what feels right for your body. Keep breathing. Think about just letting the weight of the legs go. Let those knees drop a little further if they want to. And feel your body softening onto your bed just a little more with each breath. Your body's getting heavier and heavier with each breath as you let go. So if you are having back pain, breathing is such an important part of helping our bodies to feel better when we're suffering with low back pain. Often when we're in pain, we tend to start breathing up into our chest. And that forced breath actually makes our back pain much worse. So we want to make sure that we are always focusing on really practicing diaphragmatic breathing, but especially when we're having pain. It's really helpful for the nervous system to be using diaphragmatic breathing to send the signal that everything is okay. And it also creates more space in the lower abdomen and low back. Remember, the lower abdomen is just the front of your back. So now on your next big belly breath in, when you're sending all that breath down to the bottom of the abdomen, notice how that creates more space in the low back as well. And let it go. So continue to work with this style of breathing. It will become more natural over time. It's a new habit, so be gentle with yourself. Keep noticing what you're feeling throughout your body. If your arms are comfortable, you can reach with your fingers a little bit. If your arms are feeling a little uncomfortable, just go ahead and reposition. You can bring them back down by your side if you want to, or maybe just bring them onto the bed a little more so you have some more support. Good. Keep breathing. You're doing awesome. Feel your body relaxing, letting go of all the stress of the day. Just listen to the sound of your breath, allowing those legs to drop a little more with each breath. Allow your face to relax. Soften the space between your eyes. You're doing really good. Keep breathing. Great job. So if your arms are up, go ahead and slowly bring them back down to your sides. And then we're just going to very gently engage the lower abdominal muscles. So tighten the tummy just a little bit. And slowly, slowly, slowly lift the legs, bringing the knees back together. Good job. So from here, if you have time, you're already in bed, so you don't have to go anywhere. But we're just going to either allow both knees to fall away to one side, so allow your right and left knees to fall towards the right side of the body. And then go ahead and take your left arm, and you may need to scoot towards the middle of the bed more if you need some support, but take the left arm and just outstretch it a little with the palm faced up. So if you have space in your bed, it will feel wonderful to outstretch both arms, palms up. Make sure your shoulders are supported on the bed. So really anything above the elbow should still be on your bed. If you're having shoulder pain, you need to scoot over a little bit and get some more support. So breathe, feel that nice stretch across the lateral part of your body. There shouldn't be any pain. We're just breathing and noticing. If your arms are feeling good and you're not feeling much of a stretching sensation, go ahead and activate those fingers. So just start doing that telescoping move where we're extending the fingers and gently reaching out away from ourselves. And go ahead and check in with your hips and knees. Can you soften that left leg at all? Can you let it relax? How about your right leg? Can you soften it all? Can you relax that leg? There shouldn't be any pain. You should not be feeling pain. If you're experiencing pain in the low back, just gently come out of this position or modify by not allowing the legs to fall over quite as far. So experiment with what feels right for you. We're all a little different, and every day is going to feel different based on what's going on with your body. Keep breathing. Your eyes should be closed. Sending breath to wherever we're feeling that stretch and letting it go. Picture your body just melting, dropping onto the table a little more. Good. And from here, you can either stay here if you're feeling a good amount of engagement and pulling in your tissue. Just stay here. If you'd like to increase the stretch a little bit, if you've been doing this for a while and you feel like you can go into it a little more, instead of stacking both knees and legs on top of each other, we can lift the left leg and allow it to cross over the right leg a little bit more so that it's sort of dangling. That will increase your stretch. You can also reach up with your right hand and very gently take the right hand to the outside of the left lower thigh and just hold there. Please do not pull, just hold. And that's only if you're feeling like you want to increase your stretch. If whatever position you're in is providing a nice stretchy feeling, you're feeling pulling, you're breathing, you're feeling things happening, just stay there. It's certainly not a competition. One is not better than the other, and it's always good to have options. So if you are holding on to your left leg with your right hand, keep that left arm palm up and outstretched. Keep breathing. Slow, steady breaths. Good. So for our purposes today, we're holding these positions for 5 minutes. If any of that feels like too much for you, you can absolutely hold it for less time. I'd recommend a minimum of 3 minutes for each position. If you start to feel pain, remember to slowly either modify by coming a little bit out of that position or just slowly come out of it. You can discuss it with your myofascial release therapist the next time you see each other. Good. Keep breathing. You're doing great. Okay, good. So from this position, we're going to slowly bring your left leg back up if it's dangling. Bring both arms in. Good. Engage the abdominal muscles, so tuck the lower abdomen in a little bit. And roll your legs back to center. Give your legs a couple marches, so just lift up one leg, bring it back down, lift up the other, bring it back down. Good. And then from there, let's do the other side. So go ahead and cross your right leg over your left leg and allow both either cross it over or just go ahead and stack both knees and allow both hips to fall towards the left side of the body. Let me start our timer. And then go ahead and outstretch the arms, palms up. Good. And we're looking away from our right arm to start. Make sure the upper arms are supported on your bed. Nothing above the elbows should be hanging off. If you're feeling strain in your shoulders, that's a little too much. Take some slow, deep breaths, settle in. Notice what you're feeling. This side probably feels different than the other side. It might feel a little more tense, a little less tense, or just tense in a different area. That's all normal and it's okay. From here, if you're wanting to go a little deeper into this position, we can draw that left leg so it's dangling over draw the right leg so it's dangling over the left leg. Gets a little confusing, but you can just look at the video if you're not sure what I'm talking about. We'll figure it out. And so now if you are going deeper into the stretch and that right leg is dangling now, bring that left hand to the lower part of your thigh, right above the knee, and just hold there. Please do not pull. Just hold there and keep breathing. Check in with your right arm. If you'd like to telescope your hands and reach a little bit, go ahead. Keep breathing. Notice what you're feeling. Notice if this side does feel different than the other side. Those are giving you some clues, those areas of where else you might need to be doing some self-treatment. So if you are feeling pull or ache coming from a particular area, make a mental note. You can come back to it maybe tomorrow and either stretch that area out or do a little work with your ball there. Or it might all be feeling better by the morning. Keep breathing, sending your breath down, down, sending the breath down to the lower abdomen. Good. Your eyes should be closed. You should be feeling nice and relaxed. Think about softening with every breath. If it's starting to feel like too much, just bring your legs back onto your bed a little bit or bring them closer to the middle of the body. Remember, if 5 minutes is too long, 3 minutes is great too. Notice what you're feeling in your upper body as well. Feel the connection between the shoulders and the rib cage and the lower body. That's where breath comes in. So allow that breath to fill those spaces. You're doing great. Keep breathing. Let it go. Feel your body softening onto the table, onto your bed. You're sinking onto the bed more and more. Good, and feel your whole body lengthening. Lengthening. Almost like you were pulling on a rope and someone was on the other side and all of a sudden they let go. You feel that slack come and then you just go a little bit deeper into the stretch. Good. Keep breathing. If your body feels like it wants to move, let it move. Movement is part of the release. You can trust what you're feeling. Good. So just keep focusing on your breath. If it is bedtime and you're starting to get sleepy, we're almost done. Keep breathing. Feel your whole body letting go. Good. All right, so slowly bring that right leg back onto the bed if it's not there already. Bring the arms down. Good, and then very slowly bring one leg and then the other back to the knee bent position. Very good. Let's turn our little timer off. Okay, so from there, it can feel good to either do some marching again, so we're just lifting one leg, lifting the other, and the knee is coming towards the chest. Maybe 5 of these is good. Good. Marching, marching, off to sleep. Good, okay. And then lastly, the push-pull can feel really nice if your sacral area SI joint is feeling a little irritated. So to begin, we're going to flex the feet. So flex them. They're active. We're going to pull our left leg down, almost like someone is below you pulling it. So as you're doing this, the left leg is pulling down, both feet are flexed, and that should naturally cause the right hip to rise up towards your ear. Good, and then go ahead and soften your body, relax, good. And now keep those feet flexed, and now we're gonna pull our left hip up. So now the right hip, we're pulling that leg down like someone's standing below us, pulling on our leg, like we're trying to make our right leg longer. Good, and then relax. And then pull the left leg down again. The right hip should naturally rise. Good. Breathe and then relax. Pull the right hip down, feet are still flexed. Left hip should naturally rise. Breathe, good, relax, and pull that left hip down again. Someone's standing down there pulling on your left leg and you want it to get longer. Right hip naturally comes up towards the ear. Good, and one last time, left hip up. Good, and then soften. So the push-pull is optional. From here you can either call it a night and go to bed, or just go ahead and slowly turn onto your side and take your time sitting back up. So if any of those positions cause pain in the low back, I wouldn't do them. Go ahead and take that up with your MFR therapist the next time you see them. But it's really just a nice way to end the day, take the pressure off the low back, doesn't take too long, and it's very relaxing. So give it a try. Have a wonderful day. You did a great job. Thank you so much.